Hi, my name's Kevin Dwyer. I'm the founder of HealthConnect. Every day, millions of low-income people struggle to access affordable health services like primary care, dentistry, and mental health care. Doctors and nurses want to help connect these patients with affordable services, but often lack the time or information needed.
I'm a family medicine provider in Madison, and I see patients who are disadvantaged and require extra services beyond what we can provide in the family medicine clinic almost every day.
On a daily basis, we're seeing patients in the emergency department that have a primary care issue that easily could have been handled from an outpatient clinic standpoint.
Madison is a city that has the most NGOs per capita, and yet we're not able to take advantage of that, partly because we as providers aren't aware of all the resources out there.
I want to give healthcare professionals like this a tool they can use to match low-income patients directly with the services they need. That tool is HealthConnect, a searchable interactive database of affordable health service providers.
I have cases of patients who need extra services on top of what we can provide in the family medicine clinic. Often this involves specialists like heart doctors, eye doctors. It may include seeing an acupuncturist, a chiropractor, or even getting connected with food banks in the area.
And just by entering a few keywords, patients can get connected with the right services in seconds.
My first impression of HealthConnect was that it was a really concise manner of just incorporating all of the information that the patient would need. The map was there, the phone number is there, the name of the provider that they're going to see.
The way that this service would fit into my clinic day is that I would talk to the patient, get the history, do the physical exam, and then I'd take a couple moments with this app on my phone, find which specialist fits their needs, and be able to give them the information to set up the appointment they need. This whole process would likely take 2 to 3 minutes.
We wouldn't have to do all of these searches to determine which clinics were open, which ones were seeing new patients, which ones were efficient for the patient to be able to get transport to. It would just streamline the entire disposition process.
We have a great team of people ready to bring this tool to patients and providers. Now, with your donation, we can introduce HealthConnect to Dane County and expand its coverage across the country.
I think ultimately, if we were able to decrease the number of patients that we're seeing in the emergency department with primary care issues, it would allow us to then focus our time and our resources and our staff on the patients that legitimately had emergencies, and certainly just streamline and make the entire process much more efficient.
An app that could provide each of these things would go a long way for us.
On behalf of the entire HealthConnect team, thank you for your support.